Hello and welcome to another episode of Low-Tech Health. Today is Let's Talk Tickers on Taco Tuesdays, and we will take time to think. Use your big noggin and use your small mouth. Big ears, little nose, couple of eyes, straight ahead. We're going to continue our theme of Constitution, and today we're going to talk about what irks me with nursing. We all end up having one thing that we just can't quite even. Literally can't even. It's just gotta be one thing, if not a few things, that as a nurse you kind of draw a line and say that's probably the gross thing that I don't enjoy doing much and want to stay away from all the time. For many, it's trach sputum, or sputum in general, where, tracheostomy is where they stick a breathing straw through your neck, right about here, through your trachea, and without the cilia cleaning, the nose warming and filtering, you have a lot more sputum developed because those lumens are trying to mute the inflammation by lowering the inflammation. What do you do to put out a fire? You throw water on it. So it's nice thick sputum that can just shoot with no obstacles from the mouth to the nose, just straight out of that trachea. It can get 6-10 foot range. People have been shot at the end of the bed. So yeah, it usually makes an impact on nurses, and that's the one I don't seem to bother. It doesn't seem to bother me though. But I also treat it like the Matrix. Like you're going in beside it. You're not going to treat it like it's some innocent little rabbit. That thing's a snake. That thing's a snake waiting to strike. So you gotta go in beside it, clean that trach, and then zip out. And Let's Talk Tickers Taco Tuesdays. A lot of people, it's skin flakes. There's a special nasty flavor of Asiago cheese that comes off of old people's heels and their feet when we take their socks off. Slip-proof socks, keep them from falling. They got little grippies on the bottom. It just makes sense. It's just rational. Every sock should have little grippies on them. So we take them off though. It's like an eruption of a baby powder bottle being squeezed, but it's yellow, and they're thick flakes that look like you should be putting them on a salad. Add some balsamic vinaigrette and just, enjoying a salty little snack. Oh, it's awesome to be wearing a mask all the time now with skin flakes and corn flakes. It's just corns from their feet. Raisin bunions. That's so gross. So yeah, that doesn't trip me up. That doesn't irk me. And I knew I'd probably be able to handle it. Let's Talk Tickers Taco Tuesdays when I was watching a pulmonary embolus being pulled out of a man's neck through it was a carotid endarterectomy. They were pulling out this fat globule out of a carotid artery in order to achieve greater perfusion. This is one of the interventions that is performed when you're found to have carotid stenosis, which carotid stenosis is a big indicator of potential strokes. 60 to, I think, 70 to 80% they're okay with. It's not great to have 60 to 80% of your carotid arteries, of which you have 2 perfusing your brain from the heart, occluded, but they'll work on 90 to 100%. So they'll cut it open, dig in there, take out a nice fat globule. And I'm watching this with my kid, and I know that I'm gonna be okay. I'm gonna make it as a nurse. This is still nursing school, and I'm watching this. Like, this is awesome. Just eating some Chinese food. I haven't seen it yet, but I'm pretty sure my thing will be the extraventricular drain, which is a brain drain. For a brain bleed, when too much blood is accumulating in the brain's ventricles, the little grooves that siphon out blood out of your brain can get filled up due to head trauma. So you gotta stick a tube in your brain, and they used to all the time, but I think they have a tool. It's like a drill, but they use a hand crank back in the old days, and that's what I picture, is of using one of those hand cranks and popping through the skull and sticking a little tube and sucking just to make sure the pressure gradient is achieved, siphoning out that extra brain juice. I think that might be my thing. So on Let's Talk Tickers and Taco Tuesdays, remember, know where your line is, try not to get irked, and if you're going to throw up, don't. Love you guys.